You have severe knee pain, but according to a doctor, everything is fine. No damage, no findings, and yet your knee still hurts. Then the cause might lie in a structure that's often overlooked. Your fascia, in fact. In this video, I'll show you exactly how to release the tensions causing your pain through targeted fascia rolling technique. Quickly, what are fascia? I always describe it as a three-dimensional spider web that runs throughout your whole body, wrapping around your muscles, runs through the muscles, surrounds the organs, and holds everything in place. And this system can shorten, can tighten up, just like a wool sweater that's no longer nice and soft and supple over time, but was washed too hot and has become stiff and barely moves anymore. And if you have fascia like that, you can roll it out and work to get it back into a better, more flexible condition. That allows greater flexibility. And regarding your knee, fascia run all around it, from the thigh, across the knee itself, all the way down to the foot, and they can have a lot to do with knee pain. What's the idea behind foam rolling and what actually happens during it? The concept is that the fascia, which functions much like a sponge, gets compressed, and as it's squeezed, fluid containing metabolic waste products is effectively pushed out, so that fresh nutrient fluid, fresh water, can seep or bleed in at the back of the rolling motion, where all the nutrients are located. The fascia gets cleaned and thereby becomes more flexible. Another effect is that tiny hairs on so-called fibroblasts, which are small fascial cells, depending on how the fluids flow, they receive the signal to break things down at a certain angle. This means that if a fascial strand is matted with many branches that don't belong there, it can no longer roll easily. That's the idea behind what we do, leading to the fascia reorganizing itself so that the excess strands, which have formed and contributed to this tangling, are eliminated, so that these unwanted structures are broken down and the flexible scissor grid structure can form again. Moreover, receptors are also activated during foam rolling, which further contribute to muscle relaxation. So overall, it's beneficial for the fascia and also for the muscles, and for normalizing tension and the flexible give of the whole structure, which is essential for maintaining pain-free movement. Which fascia rolling massage do I recommend to you now for your knee pain? For the calf and the thigh, you can either use our MediRoll, which has the added benefit of a small groove here, or simply grab a standard water bottle to get started. If you're lucky, there's also a little indentation here. It's a little too large, but better than none. And then you carefully position your Achilles tendon right onto these indentations and slowly roll downward toward your buttocks. We'll show it with the right roller. It's important now. You need to roll very slowly and apply strong, consistent pressure throughout. To help you roll firmly, our fascia roller has a soft surface that becomes really firm deep down. That means you can build up a lot of pressure, allowing you to really get deep into the muscle tissue, to create a kind of wave effect. And besides using strong pressure, you should move extremely slowly, because these are tiny spaces, and if you roll over them too quickly, you'll just roll right over the liquid. You need to give the liquid time to move along with the rolling motion. We'll show you. Press down firmly. If you feel you can take more, place your other leg over it and press down with that one too, then slowly start rolling forward. More and more. Very good. Very slowly, and you'll do the same at home. Very slowly, always rolling in the direction of blood flow. Back towards the heart. And press firmly. Press down really firmly. And keep rolling continuously, slowly, but don't stop. Stopping would be too slow. Very good. And then you'll notice the higher up your calf you go, the more painful it actually becomes, really intense. It's probably getting really uncomfortable there now. Slowly, firmly, keep rolling steadily onward. Take your time and vividly imagine how this fluid is being effectively pushed out, while fresh fluid steadily flows in at the back of the roller, replacing what's been displaced. And make sure to roll over the back of the knee as well. Even if you happen to have a Baker's cyst, just reduce the pressure slightly, but still roll over it so the fluid can move there too. And then you should also roll up the entire thigh, because the back of the thigh contributes to the knee joint space becoming too narrow and having excessive pressure placed on it over time. And then you keep rolling upward, all the way to the point where the buttock begins. And if along the way you happen to notice any particularly sensitive spots, you can just pause there for a moment. Wait until the receptors have brought even more relaxation, and then keep rolling again. Okay, and stop. Now let's focus on the thigh once again, from the tibial tuberosity, over the kneecap, and up into the groin area. You can also do this lying on top of it, but if you're a beginner, it's easier like this. Place the roller close to this notch so you can apply firm pressure and then slowly roll upward toward the hip. It's also a good exercise for arm strength, so you can press down really firmly. If you notice that arm strength doesn't even come close to producing any kind of rolling effect in terms of intensity, then it's clearly not enough. Then you turn onto your stomach and attempt to do it in the same manner as with the calf, simply by positioning yourself and lying down on it. But that's a bit more complicated. Try it like this first. Press firmly and roll very slowly. And when you get to the top, you can just lean back a little bit. So that you've got space there. Exactly, up to there. And if you'd like an even bigger roll effect, you do the same thing once again with slight angle adjustments, taking the foot slightly outward, for example. And roll up again the calf and take the foot slightly inward once, then roll up again, and on the thigh you'd also do one straight, just as Ina has just demonstrated there, then once more tilted outward and once more tilted inward. And when you've rolled it like that, walk around a bit and compare it to how it felt before. You'll be surprised how different it feels. And as needed, simply do the same thing on the other side as well. Now you know how we recommend rolling your fascia. In the next video, we'll show you how to actually integrate exercises like this into your daily routine and make them a habit.